Okay, this is Rich Wicklund. I'm the CEO of BenefitsApp. I want to thank everybody for attending our webinar regarding back to school strategies and how BenefitsApp is supporting our clients. To get started, a little housekeeping. I have Nancy McCarthy monitoring the chat feature. So if you have any questions, please feel free to chat them into the chat window and we will address them either during or after the presentation. Today's webinar is in regards to back to school. As schools are starting to get back to school and understand their strategies for next month and going forward, we've had a lot of interest in the BenefitsApp and its COVID-19 toolkit. So we'll speak to that. We also will be speaking about our partners and some of the things that we're doing in support of our schools and helping them get back to school regarding COVID-19 testing, as well as tracking of temperatures, fever monitoring, some innovative things going on in the market that we just want you to be aware of. And we will present that as we go ahead. So as you can see here, we all know COVID-19 testing is in the news. I try to keep these presentations current because this is also new and developing quickly. There's an article in CNN just this Monday about COVID testing, contact tracing, saying it's key for safely reopening schools. And we'll talk a little bit about the findings that they have through two articles in the Lancet Journal. And so we'll talk about that shortly. We have a quick, a brief presentation. For those that have not seen the BenefitsApp, we will walk you through and show you an implementation we have in place for a school and the back-end system that we have, which is our Human Resource Officer portal that gives you real-time access to information to allow you to track, trace, isolate, and work with your employees, faculty members, and students. At BenefitsApp, we always start by saying benefits made mobile or benefits made easy. We put the whole concept of COVID-19 and contact tracing within the context of employer-sponsored benefits. So in particular, for your faculty members, for your employees, we provide information regarding benefits, your employer-sponsored benefits for those individuals. Within the BenefitsApp, everyone gets a custom interface. So if you are a faculty member or an employee, you might see a BenefitsApp that looks like what you see on the screen here that says X Corporate, where you see that logo. It would change to be your school's logo. And the benefits would say probably 2020 employee or faculty benefits. Alternatively, if you deploy BenefitsApp to your students and their families, it would say your school and then 2020 family or student benefits. And that can all be controlled with an eligibility file, a student roster, and we can also control it by age. And so it's a toolkit that's very easy to download, use. BenefitsApp is available from Google Play and the Apple App Store. The system is based on a platform called Salesforce.com. And what that really means is that it's HIPAA compliant. It's compliant insofar as all sorts of security, SOC 1, SOC 2. If you're familiar with the Salesforce.com platform, you'll understand it's a global platform. And all you need to know is that it provides us a wonderful platform that is highly secure so that your data is safe. All of our employees are HIPAA certified, and we place a lot of emphasis on security of your data. BenefitsApp was originally designed to bridge the communication gap between open enrollment and when employees need benefit information throughout the year. About 8 weeks ago, 10 weeks ago now, clients started to ask for a COVID-19 screening feature. We deployed rapidly a COVID-19 screening feature that we will demonstrate for you today. Not only does it offer a screening, which is a CDC-based survey that results in a green, yellow, or red status, or in the instance that we'll show you a green or red status. It also offers a digital signature feature that allows you to easily, employees or students or families, to easily acknowledge your school's policies related to COVID-19. We've heard that there are many different options out there. There's the honor system. There's the, we're going to send a form, have somebody sign it and send it in. We feel that the BenefitsApp option, which is a display within the app and use your finger to sign that policy document, is very easy, it's fast, gets the job done, and then you have a copy of it in your system in the BenefitsApp Human Resource Officer portal. We'll show that to you shortly. At the beginning of the presentation, trying to keep our webinars very current, this Monday, CNN had an article, COVID testing, contact tracing, key for safely reopening schools. 2 new studies suggest. And I just want to highlight some of the topics. I can forward those that are on the webinar, this article, or you can search for it pretty easily Google CNN COVID testing, and there's plenty of information there. They have some commentary, and the commentary begins with Dr. Gupta, if you're familiar with him, saying that schools are doing the following. They're applying best practices, and as school administrators, I'm certain I'm preaching to the choir. So I know what you're doing. You know what you're doing. We're creating separation, making certain everybody's 6 feet apart, requiring face masks, doing directional things, setting desks all in the same direction. According to the doctor, if we keep breathing in the right direction, same direction, it just becomes a little bit less distributable, as well as maybe setting rules around walking in certain directions within a room or in hallways. Another thing that's happening is potentially cohorting of students, and the whole concept of gathering students together, and the idea around contact tracing is that if you have groups of students together and somebody starts to be symptomatic, you can just isolate that cohort and understand that they're not going to spread it to others. Again, there's a lot going on here. I don't want to say I'm an expert. I'm certain everyone on this call that's out of school is dealing with this and are experts. But these are some of the top level things that we've read. The two studies really focus on test, trace, and isolate. Historically, BenefitsApp has been focused on the tracking and contact tracing, and we'll show that to you. We have some options now for testing. We do not have an option for isolation, but we're looking at the testing, tracing part of it, and we'll get into that in a minute with our partners. So the majority of symptomatic people should be traced. If you have symptoms, you need to get tested, and then you should be tracking who those people have been in contact with. The general principle is we need to stop the spread. And so it's suggested, depending on the scenario, that a majority, 59 to 87% of symptomatic people in the community should get tested. I'll make note in a few minutes with a partner of ours, TouchCare, how they can help schools with testing on site. And so we'll get to that in a minute. But it's important to get people tested right away. The study also says that symptomatic infection can be diagnosed and contacts traced and effectively isolated is important. So a test, trace, isolate strategy is important. We should be speaking in those sorts of terms. Testing to make, see who, if they're symptomatic, do they have COVID? Tracing, contact tracing, and then isolating, sending home or isolating within a school until they can go home. Without that sufficient coverage, then the epidemic will continue to spread. And so I think we all know this through what we've been hearing on the news. It's being backed up with scientific studies. So to have maximum impact, test and trace as soon as possible, identify, isolate, and then try to quickly get ahead of the outbreak. So within school systems, BenefitsApp is working to help you test and trace so that you can identify those students that might be symptomatic and pass it to others. This was an amazing fact to me. The Lancet Child and Adolescent Health in Australia, an Australian researcher found that 27 people, these were either children or staff at a school, were diagnosed as symptomatic. What was interesting is through contact tracing, there were over 1,400 close contacts were identified. That's a tremendous amount of information. And so, this is not an insignificant situation that we're going to be dealing with. And so with BenefitsApp, we're trying to create systems that automate, facilitate the contact tracing, but then automate the follow-up with those close contact individuals. And we'll show you how we do that with email presently. We send out alerts. The good news, I guess, in that study is that of the 1,400 or so that had close contact, 633 were tested, but only 18 appeared to be positive. That's the good news, though I think we all know that testing is not necessarily always 100%. And there are other statistics out there that say that this spreads very quickly. So what are we doing about it? BenefitsApp is a platform technology. We help to convey, we close that gap in communication around between open enrollment and employee-sponsored benefits. Schools have recently come to us. In particular, one school has 300 employees, faculty members and employees, 2,100 students. And they have a need for understanding the health of their student population, their faculty, before they get to school. And so they've approached us about our COVID-19 toolkit. We've presented to them that they can have a BenefitsApp that's geared toward their faculty members and their employees. And then another group that would have a subset of the Benefits app that is just the COVID-19 toolkit, which includes a short survey, and then in the back end, contact tracing, close contact alerts. Further in the presentation, we're going to talk about our partner TouchCare. I believe we have somebody from TouchCare on the webinar listening in, but I'll tell you about what they're doing with the ability to do bulk testing. TouchCare is a health advocacy company. So if you can imagine an employee or a faculty member has become symptomatic, they take a survey, they get a red score that says that they should stay home or monitor symptoms. What do they do next? We've all had family members probably by this time that have become symptomatic. And the question is, all right, what do we do? TouchCare allows you to call somebody. Call somebody who knows you, understands what your benefits are, and can help you get tested. They have just recently, this week, announced that they can now offer an FDA-approved bulk testing kits for employers and for school systems. And so we'll talk a little bit more about that. And the idea is that if a student is symptomatic, you could test them on site and then send them home. So you have some control over that. Lastly, there's fever monitoring. So we're looking at technologies and partners that offer entry monitoring where temperatures may be taken at the door, and that information is filtered right back into the Benefits app, into your human resource officer portal, as well as an option for visual monitoring, which is a little odd to me, but I'll describe it to you. And if you're interested, we can connect you with our partner, Gentag, on that option. For those of you who are not familiar with Benefits app, you download the Benefits app from the app stores. It's very easy. It's very fast. You just tell your employee or your student, go to the app stores, Apple or Google, search for Benefits app, look for the green and blue logo, install it on your phone. When you do that, the first thing you do is register. So you register with your email address, your first name, your last name. You choose a password. You can select a language preference. You enter in your school code. So if it's, I went to a high school called NMH, so I would put in NMH. And then I would put in my student ID, which could either be a specific ID that's provided to us on a census file, or it could be just my last name and the last four of my social, a unique ID. When I gain access, then I can log in and register for Benefits app. With modern phones, it does face recognition. So once you register, it will log you right in. I'll demonstrate this for you in a minute. And you see your benefits. If you're an employer or employee or faculty member, you see all your employee sponsored benefits. If you're a student, you might just see the COVID-19 resource, as well as the ability to sign a document that is your student policy around COVID-19. So that's what we'll be demonstrating for you shortly. You click to access information. You can upload as an employee or a faculty member your ID cards. You can look at calendars. You can have contact forms that are HIPAA compliant, as well as links to partner apps. You have all your benefit information that's available to you. And then you also have access to your profile, which is information provided within your census file. For your employees or your faculty members, if we have information specific to their plans, their medical plan, their dental plan, this would also be available to them under their profile. For COVID-19, we have 4 steps. We send out a push reminder. So the push reminder is an automated alert that comes out every morning at a time that you would like. So let's say it's 7 a.m. or 6 a.m. A push reminder shows up on the employee's phone, or the student's phone, or the parent's phone. It's set to their local time, and it's click to access your Benefits app survey, your COVID-19 survey. The COVID-19 survey is CDC-based, CDC-based recommended survey. We have both a short survey and a long survey. You may want the long survey for your employees or faculty members, or you may want the short survey for your students. Once they take the survey, depending on how the survey is answered, they will be given a green, yellow, or red status. In the example that we'll show you today, the school asked just for the green or the red status. So Benefits app is very configurable to each school's needs. It's also configurable by group. So if you have faculty members or employees, you may want a green, yellow, or red status. And depending on the group of employee, their yellow may say, you're essential, please come to the office and we will screen you here. or if they're not essential, please stay home and monitor your symptoms. Further, we have a digital signature tool built right into the app where you can sign with your finger that you understand the company policies, the school's policies. And again, this can be specific to the group, be it a student, parent, faculty member, or employee. In real time, your human resource officer has access to a portal. We can set up the portal for a global administrator that might be in charge of faculty members and employees and students, and then a subset that is just for the student population. It gives you real-time access to the current status every day of your employees and students. So for the one that has 2,400 total employees and students, that number 56 there would say 2,400. How many of them have taken the survey and what the status of their survey is. Everything we show you today will be in what we call a sandbox. So it's not real data. It's just meant to show the feature and functionality. We then have comprehensive contact tracing that we'll show you that results in automated email alerts to those people, students, employees, faculty members that have come into close contact with someone in your organization that is either symptomatic, has been tested and has COVID, or has also been in close contact, depending on what your policies are. So these emails go out immediately, then 3 days later, and then 7 days after they contact as a follow-up. The CDC recommends a consistent follow-up that gives information, but is also totally confidential to the individual that has the symptoms. So with that, I'll give you a demonstration. Nancy, if anyone has offered any questions through the chat window, please let me know. Everyone should be seeing my phone now. Again, BenefitsApp is available from the app stores. Anyone on the webinar could download BenefitsApp and install it, and we can provide you with a demonstration, a login that you can use to see the BenefitsApp. We designed the logo to be bright, and so that you can see it on a dark background on your phone, or if it's among many different apps. And the term BenefitsApp is easy to see and read. When you launch the app for the first time, I'm going to cover my facial recognition. It will give me the welcome screen with the option to register. So when I click on register, this is where I put in my email address, my first name, last name, choose a password, my language, my company code. So this is where I put in my school code, and my member ID, which would be, potentially my last name and the last four of my social, and my mobile phone number. As a benefit of using BenefitsApp for our clients, what's nice about this is that you do aggregate and collect mobile phone numbers for all your users of BenefitsApp, as well as their preferred email address. Once you've registered, when you register, you put in your mobile phone number. You're texted a code. It's called two-factor authentication, which is high security. You enter that code into a window and you complete your registration. Once you register, you then log in, and it will ask you to remember your name and password with face recognition. And that's what you'll see here. I'm already logged in with one of our school clients, and so it's going to face recognize me. It's going to log me in. What you're going to see at the top, again, is your school logo, and this would be a staff app. And you see your information, your latest status, and they've chosen to go with a very short benefits app. So you don't have all of the icons. You can start with just the COVID-19 toolkit, and then you can add information around employer-sponsored benefits later. Within the system, we have a link to contact human resources. This would be a link to your human resource officer, click to call, click to email, but also contact your plan administrator, where you can enter in a subject, upload a file. So let's say that you have been identified that as having COVID-19, you can upload a letter from your doctor saying that that's the case. In our toolkit, if I go under our daily screening, this has been modified to meet their specific needs. So they have a green level 1, a red level 3, and a red level 4 status. I believe we're launching this app shortly, and I believe we're going to go just to green and red. Within the green section, you can edit this information, so it's very specific to your school. If I hit the back button, I can go back and I can read my red instructions. So this can be very tailored to your school. When I click on my daily health screening, there are really just 3 questions. Are you experiencing any of the following COVID-19 related symptoms? And so you can say, no, I'm not. Have you been in close contact with anybody? And I could say, no, I have not. And then it's going to say, do you acknowledge that you've taken your temperature recently? And I could say yes to that. And then I could submit that. When I submit that, because I answered no, no, and yes, I get a level 1 green status. We've designed this screen so that your employee, your student can walk up to the door, show whoever is greeting them at the door that they have answered the survey, see the date, see the name of the person, and then you can also see an index of what the levels mean. And so it's meant to be something that you can display as you enter the system. We are also looking potentially at having the option for a QR code that could be read by a temperature monitoring station. Further, we have guidelines that we've entered in, so you can read the individual guidelines. That's all, again, specific to the school. And then we have a digital signature agreement. So this is our digital signature tool specifically for COVID-19. Really, any form of PDF or Word file can be presented here. And so what we ask is that the person enter their name, sign with their finger, and enter a time. The date is already put in, but we'd like to know the time. When you hit done, continue, and agree, that digital signature agreement has been stored within the BenefitsApp Human Resource Officer portal. Further, if you have related contacts in your eligibility, let's say you're part of a family with multiple students, those related contacts will be available here as well. It's probably more important for employees where you can see other folks within your eligibility for your benefits. If you look on our website, we have other videos that show the full benefits app, but for this instance, we're going to continue with our presentation. The next thing we'd like to show you is the back-end Human Resource Officer portal. So in real time, outside of the BenefitsApp app, your Human Resource Officer will receive a separate name and password login to the BenefitsApp Human Resource portal. This portal is based again on the Salesforce platform. It's multilingual. You can choose any global language, Spanish, French, German, whatever you're comfortable with. You have access to your constituents, which would be your employees or potentially employees and students, any sort of surveys that have been submitted, agreements that have been signed, and then reports. In particular here, we're focused on how many people have taken our COVID-19 survey. Again, this is all sample data for illustrative purposes. We have a contact tracing facility, and we could see the employees or students that are at risk. We're also keeping this as historical data, so we can provide you reports of historical data that may be useful at some point in the future. The whole system is fully supported by our staff, and you always have access to an engagement manager that can help you at an 800 number or by way of email support. These donuts will take you through to a full report, or I can go into a subset. I'm just going to click on the subset of red because I'm interested in understanding how those employees or students are doing, and I want to initiate a contact tracing strategy. Within this, we see that we have both Brenda and John that have red status within their survey. I mentioned before that we send a push notification every morning to have people fill out their survey. If you have a red status or you are told to isolate for anywhere from 3 to 14 days, those push notifications are turned off until that next date appears. So if it's 14 days from now, you will not be bothered until 14 days from now. Within the system, you can go look at surveys and you can understand how the employee answered their questions. This happens to be questions on a long survey. I can follow up through an interview with the employee with survey follow-up questions. Again, these are CDC recommended follow-up questions. When was the date of your symptom onset? What were the symptoms that you had? These are the sorts of questions that may be answered by our partner TouchCare, again, who is a healthcare advocacy vendor who will understand your employees' needs, their benefits, and be able to do things like these follow-on surveys. They can ask, what are your symptoms? Have you been tested? And what is the date of your testing? Do you know your test results? Have you been hospitalized? Do you have a report available? If so, that can be submitted by way of the Benefits app. And do you have any other at-risk conditions? When you save that, that information is stored for your records, and then you can go do contact tracing. So in this example, John Doe has had close contact with another employee faculty member. You can look up the employee faculty member. We have the ability to say, share this information with your close contact. This is typically just company approved or company policy. You put information about the meeting, the location, the conference room, the date and time, and the duration. If you have a student that is in a setting with multiple students, you can simply do the first one and then you can clone it. So we try to make this as efficient as possible. And so you would clone and you would simply change the name here to whoever the close contact was. So John Doe is also in a room with Rich Wickland, in a certain classroom, certain date and time, and hit save. When that happens in real time, an email is sent to that contact and it looks like this. So we have a close contact alert. It is specific to your school, but also personalized to the employee or the student family member that was in close contact. So it says, Dear Rich Wickland, we want to notify you at this location, this room, this meeting time, event, and duration that you are in close contact with someone that has a confirmed case of COVID-19, exposure to COVID-19, or has been associated or related to somebody with COVID-19. So this is an email template that's sent out immediately to that close contact, total 7 days later. So 7 days from the initial warning. The CDC recommends two things, well, multiple things, but one, this has to be confidential. So we do not let the person know who has the COVID symptoms or COVID-19, just that they were in close contact. And then secondly, not only follow up once, but follow up multiple times to make certain that the person knows it's important either to go get tested or to isolate and monitor their symptoms. Back in the portal, you can go to that employee, and we have tools for visualizing the close contact, which is a relationship viewer that allows you to see who that person's been in touch with and the spread of the contact. Again, there's a lot of data out there that says, as you get further away from that contact, you're less likely to get COVID-19. Our goal is to give you the tools to understand where the contacts are and understand the network so that you can take action on those items. Back to our presentation. As I said initially, so we have our COVID-19 toolkit. That is good for the awareness, understanding who may be symptomatic, who may be in close contact tracing, critical items. Through our partner, TouchCare. TouchCare is a company based out of New York and New Jersey. They're a health advocacy company. I would like to say that if you're interested in what I have to present here, please contact us and we will get you in touch with someone from TouchCare. They help clients with health advocacy. So if they want to review a doctor's bill, get a doctor's appointment, understand what anything means, they work with your employees, your faculty members in understanding that. Just this week, they have announced that they can offer bulk testing kits for companies and schools. So COVID-19 toolkits that can help maintain a rigorous testing of employees and students without the hassle of coordinating testing facilities or risks associated with in-person visits. So if someone is symptomatic within the school, it is an option for you to provide them with testing. And so I think that is unique. I've not heard about that before. And in this day and age of people lining up for hours to get testing, as those articles said, the faster you can test, the faster you can contact trace, the faster you can isolate, the better off we're all going to be. So they offer bulk testing. My slide's a little bit out of whack here, but it's their TouchCare Shield. It's an in-home viral PCR test. It's FDA approved, and it's easy to deploy. It's a saliva test, saliva collection method. It can be done without professional oversight or assistance. Results are delivered within 72 hours and being received at the lab and boast a high accuracy rate. These kits can also be held for up to 12 months on the shelf. I'm told that they can provide up to 500 test kits at a time. So for our clients, we're able to offer this to you through our partnership with TouchCare as a way to do in-school testing if that's something that you're interested in. Further, we have been investigating. Some of our clients have asked us about temperature, fever monitoring. I never knew how challenging fever monitoring is. And I never realized growing up with my 3 children and just growing up as a person myself, when you take your own temperature, you're typically in a very controlled environment. You're probably in an air-conditioned home, and your thermometer is calibrated to read your temperature within a fairly controlled environment. So temperature checking is challenging. What we're doing is working with a couple different partners such that we can offer solutions that are integrated with BenefitsApp. One is a product called CapScan, which is an on-site kiosk. So these are deployed at organizations where when you show up at the door, rather than having the risk of a greeter sit there and take a temperature, employees can walk up to a device, would then be able to read either facial recognition or, in our case, a QR code that would be available from the Benefits app. And when they scan that QR code, they pass their hand through an optical scanner that will read their temperature. That temperature then and there will then tell them their temperature and whether they should go into the office or into the building or not. It will also take that information and pass it through our API through the Benefits app. So at the employee level, you will know the employee's temperature. Again, this is all related to having a healthier workforce, but also risk management. You want to know someone has a temperature when they show up. Again, temperature management, fever monitoring is challenging. I spent a few hours with an expert on this, discussing this, and he explained to me how difficult it is. The fact is that people also game the system. Parents will send their children, and their children wake up with a fever. They will use Tylenol, control that fever, and send them to school. There are issues around sending people to school with a fever. I think more and more these days people are aware they should not do that, but in instances where folks need to go to work, there are ways to make that fever go away for a period of time. And so in addition to on-site products integrated with BenefitsApp, we're looking at fever monitoring devices. Again, these are devices. There are 2 that we're in discussions with a partner on called GenTag. They have one that's a Bluetooth fever patch, and this is a patch that you would put on your arm or on your body, and it would, for up to 5 days, monitor your temperature and send that wirelessly through to Benefits app or to your phone and then to Benefits app. So that's one option. Another option, which I think is somewhat challenging, is an optical fever patch. That's a very inexpensive patch that would be used daily, which basically you would put a patch on your body and you would be able to visually know if someone is starting to exhibit fever, that patch would go from a dark color to a red color. And the strategy is that a teacher or administrator could monitor the fever or the temperature of all the students in a room simply by looking at them and seeing if the patch is a dark color or if it has turned to red. And if it has turned to red, be able to, again, test and isolate that student. So those are some options that we're looking at to help our schools with an effective back-to-school strategy. More information is available from us. If you'd like to contact us, we can share it with you. So now we get to the end of our presentation. We often have several common questions. Is the app multilingual? And the answer is yes, it is. It is available also to anybody that has access to the app stores, be it students, faculty members, employees, parents. And we have a significant amount of control over the access to content based on a census file that is provided to us by the school. You could do a benefits app that is either the full app, which includes multiple icons and tabs and features and functions, or simply just the survey. Everything we do is full service. And so the survey, by the way, is a COVID-19 toolkit, which includes a survey and the digital signature tool. Everything we do is full service. If we are just deploying the COVID-19 toolkit, that deployment can happen within a week. And so it's very fast to deploy and can be used by your school system very quickly. If you have a need, please follow up either with us directly or through your benefits provider. Nancy, are there other questions that have been presented during the presentation?
Just one question around the portal. And if they have somebody who does, takes care of staff and faculty versus somebody else who takes care of students, can they have two different portals to be able to, have different people looking at different things?
So yes, absolutely. So our system is set up so there's a hierarchy, and within a school system or within an account, a user can have access to, in that example, to just employees or just students or both. So we have controls that allow us to limit that access. That's a great question. We've heard that from others. Another question is, the different types of surveys that are available, and we follow CDC recommendations. We have what we call a long survey, a short survey, and an essential survey. And so these are the three types of surveys that we offer, and we find that they meet pretty much everyone's needs. And if you like, on our website, under resources, if we don't have it yet, it will be up there shortly, a description of the questions and whether and which survey they are on, short, long, or essential. The Benefits app is highly configurable. We look for our clients, because this is an evolving need, to say, hey, can you help us with this, or can you help us with that? We have on our roadmap certain integrations that are coming that can be seen on other webinars. Sure.
One other question came in. Can you explain the contact tracing? How does the app know who a user has been in contact with?
Thank you. It's a great question. This is a person-to-person interview, so it is not automated. There's a lot of information out there about automations of people being nearby and tracking, and we've heard of Apple and Google offering solutions for close contact tracking, but nothing has emerged as the clear and certain leader. Contact tracing is a human-driven process. What you would do is someone that is symptomatic or has COVID-19, you would literally call that person on the phone. During that phone call, you would ask those supplemental questions, and then you would say, who have you been in contact with? In our opinion, you want to have your direct contacts within your organization. I'm not certain if you want to, we don't have a facility to go outside of your organization. So you would say, while you are in our facility, who were you in contact with? And so if I was an employee, I may have had a meeting with my human resource officer, or I may have had a meeting with my manager or with my manager's team at a certain time, location, date, and for a duration. And within Benefits app, because we have all those contacts within the system, you would do a quick lookup, select that name, put in the information of where, when, location, duration, hit save, and that related contact will immediately get an email. Then you would say, was there anybody else in the room? Yes, there was another person. You would clone that record, make a copy of it, change the name, and hit save. So you do that as many times as for who was in close contact. If a student was within a cohort or within a classroom, again, you would have to do that for the number of times that person was in touch with somebody. It's a significant amount of work, I believe, but we've tried to make an efficient process of it. And again, through our partners, we can offer that as a service to help people not only do the close contact, but also, again, the next step is, can I send you an in-home test, or can I get you an appointment for a COVID-19 test? What those articles were saying is the faster you can test, the faster you can trace, the faster you can isolate, the better off we'll be on a global level. So it is a human-driven process. There's no automation there, but we feel our product is very efficient. And then further, we keep track of all that data so that you will have records of the close contact, how you resolved it, when people were alerted, and the ability to have them sign a policy document such that if there's any sort of issues in the future, you have all the information you need to support that you have delivered a best practice as recommended by the CDC and others in support of your organization. So I think I'll finish up. I know that some of the organizations on the webinar today are groups of organizations, groups of schools. We'd be happy to present this to them. A recording of this presentation will also be on our website probably by the end of the week. So that will be available for people to review. If someone is interested in deploying the Benefits app, again, we can deploy it very quickly in support of schools getting back to school. So please don't hesitate to give us a call. We are here to support you. So I'd like to thank you for attending our webinar. You can reach us at sales@benefitsapp.com. Please go to our website under resources. There's a tremendous amount of information about our product. There's also a link to our COVID-19 toolkit, where you can see more information about that. And we look forward to everyone's success here. So thank you very much and have a nice day.